welcome to Talkin Telehealth. I'm Erika Grau.
And I'm Kathy Ford.
Telehealth is having a dramatic impact on the way patient care is being delivered. On our show, we'll examine how telehealth can simplify communication, improve office workflow, and most importantly, drive better patient care. In addition to hearing some great clinical stories about telehealth in practice, we'll talk about where telehealth is today and where it's going, including how the latest regulations are impacting provider operations and reimbursement. You can find podcasts of previous episodes of Talkin Telehealth on our program page at HealthcareNOWradio.com and Rhinogram.com. Be sure to follow us on Twitter at #TalkinTelehealth and follow us at Rhinogram on Twitter. So, Kathy, you've been pretty busy this September with some back-to-back-to-back virtual speaking engagements.
Indeed, that is true. You know, Erika, the onset of the COVID-19 pandemic in the U.S. and actually across the globe has dramatically changed the landscape of healthcare, including how our own industry comes together, how our own industry thought leaders come together, and how we share ideas and best practices. Everything has gone virtual, including our conferences. Trade shows have all been suspended. But I'll tell you, it was a fantastic opportunity to virtually join some great industry leaders from across the country for some high-level discussions during this unprecedented time.
That's great. You know, September really started out with a bang with the Telehealth Online Virtual Summit, where you led the discussion, Telehealth Connectivity, bringing telehealth to the developing world and the wider population. The panel included the likes of CEO of provider organizations, women health initiatives, health plan executives, and other. I loved hearing the discussions from a panel of all-female healthcare powerhouses on topics including bridging the digital divide to understand communities with no access to broadband, introducing virtual care platforms to areas of needs, how healthcare providers can increase access to convenient, efficient, high-quality care to their patients, and honestly, hearing the must-haves of when shopping for a virtual care platform. The following week, we attended the Modern Healthcare Virtual Health Summit. That show is brought together by healthcare executives, physician leaders, and healthcare innovators to focus on addressing how health systems need to scale operations to address the rapid adoption of virtual health by patients and by health systems. Kathy, you joined another educational session titled Virtual Health's Big Moment, How Health Systems Are Rapidly Scaling to Meet Demand. Another fascinating panel to watch as you covered topics including best practices for efficiently expanding access to virtual care and ensuring positive patient experience, strategies to enable clinicians and staff to work effectively in the virtual environment, and tips for how organizations can avoid common pitfalls in virtual care expansion. And later today, you'll be speaking at yet another virtual conference, a regional MGMA's virtual event titled The Virtual Patient Experience. I can't wait to see how that one goes next time we talk.
I'm really looking forward to it.
All right, well, let's jump right into it. Let's talk about where telehealth is today. It's in a constant state of evolution. Catch us up with what you've been hearing from the healthcare leaders you've recently met with.
It's been quite an interesting last several months as everybody continues to experience. But what I want to share first off is on the positive side, it seems to be pretty universally understood that there is a gap in the existing technologies that delivery organizations have in place, such as their EHRs, when it comes to moving to a true virtual care approach. I really see this as a positive move, not just because it's been fantastic for Rhinogram, the leader in virtual care platforms, but honestly, when I think about for all the patient populations that were already in need of better care, already in need of more care, easier access to care, as we've spoken about a number of times in past episodes, as it relates to underserved populations and rural communities. And now we can add another one to this list, safer care. So we need to know that our how we're receiving care, we're not putting ourselves at risk when we don't need to, whether it be for COVID or for the flu or for anything else.
Kathy, are you seeing any trends with particular specialties or segments within healthcare when it comes to making investments in virtual care technology?
For sure. It's probably not surprising to anyone that many of what I would call the key specialties, heavy use specialties such as pediatrics, OBGYN, primary care for sure. I'd also say gastroenterology. All of these specialties, especially those that have a high number of millennial patients in their populations, because as we've discussed in the past and what we know and continues to be the case, that population group, that the millennials certainly would prefer to not be tethered to a telephone call in order to coordinate care or to manage their care needs. But what I tell you, in addition to those key specialties I just named that continue to come up over and over again in nearly every conversation I have with delivery organization leaders, as far as outpatient service lines, behavioral health continues to jump up in conversations as the new need, but also heavy users as it relates to virtual care. So I'm pleased to see that. Of course, when we think about behavioral health, what's really important is reach and connection, and using a virtual care platform that removes all those barriers and makes it super easy for patients in need or patients at risk to be able to get in touch with and have a conversation as a starting point is critical. So I think that's why we're seeing behavioral health, and I'm hearing about behavioral health as a new focus for these healthcare leaders as far as implementing virtual care and extending and making sure they're covering the behavioral health focus area. But I also want to share some interesting conversations recently with other delivery organization leaders and thought leaders across our market space from a different lens that they're thinking about, which of course affects many of those specialties that I just mentioned. And what I'm talking about are those specialties who are participating in some kind of BPCI and or commercial bundle programs for reimbursement, and the role that virtual care platforms can play in achieving the goals for these programs, which are many and complex. Traditionally, virtual care visits, I think as we all know, have been used in sort of a reactive mode by servicing low acuity, on-demand inquiries from patients in that virtualized urgent care model. It's really how it was pre-COVID. But I will tell you, with the rollout of value-based care programs that focus on patient outcomes, health systems and health plans, payers can also use virtual care in a more proactive way and reach out to patients that are facing transitions in care, close those gaps in engagement and making sure that your patients are compliant and adhering to those care plans, especially all of your patients that have chronic conditions and are on chronic management plans. This is a really big benefit of a virtual care approach. And again, going back to the reality that a platform that services this entire new paradigm is the gap in the market, but also the pursuit of our healthcare leaders, as I'm learning. There are a tremendous amount of programs with different elements that are focused on outcomes. It's honestly, when I look at it or when I am hearing and reading about it, It's like a giant puzzle. For example, what we know, some of the common ones: Medicare access, CHIP Reauthorization Act, accountable care organizations, comprehensive primary care plus, Medicare Advantage, delivery system reform, incentive payment programs. It's a very long list. There's also the primary care first. This started as a voluntary 5-year alternative payment model to help reduce the Medicare spending. And essentially, like so many of the other models, really, it's all about preventing avoidable hospital admissions, improving the quality and outcomes, and increasing access to care, especially with those patients with those complex chronic conditions and comorbidities and serious illnesses and diseases. This model specifically aims to benefit quality and value through an innovative payment structure, and focused around the primary care segment.
So what are some of the benefits of participating in primary care first?
There are several, but as I just kind of pulled together some of the top ones that I hear about that our primary care organizations are focused around, it seems to be one being the opportunity to increase revenue based on performance-based payments that are rewarding those primary care physicians when they are able to reduce additional hospital utilization or unnecessary. So certainly revenue and payment incentive is certainly a major benefit and a driver. It also expects more actionable and real-time data as far as making decisions around care transitions and how to affect your performance as it relates to your peers and the industry. It's very specific as far as giving these primary care physicians a way to focus on single outcome measures that impacts each patient. So I think that those are also really big benefits. And naturally, anything that has anything less from an administrative burden perspective and more flexibility is always going to be a fantastic benefit, frankly, for anybody in healthcare, but certainly for the primary care segment. And that is one of the advertised benefits of primary care first. But in addition to primary care first, if we talk more about BPCI, which is the Bundled Payments for Care Improvement Initiative, and there's also an Advantage element to it as well. It was started around 2013, and it was sort of one of the earlier initiatives from CMS around value and outcomes-based reimbursement models in a bundled format. So really interesting how it's evolved over the time. But unlike the fee-for-service model, which sort of reinforces silos and bundle payments for all services in an episode of care, so BPCI certainly provides incentives for hospitals, but also for post-acute care providers, physicians, and other practitioners to be aligned and encourage collaboration across the settings. And again, so this all goes back to communication, collaboration, all with the patient, in the center of it all.
So, Kathy, what are some of the success approaches?
Well, I've heard sort of a reoccurring theme when I'm talking to these organizations. Some of them are really high volume orthopedic surgery centers. Others are primary care, very large primary care groups. And what they say are things like creating touch points throughout the continuum of care making sure that the patient is engaged throughout the entire journey. So literally as soon as they're discharged from an acute encounter, that there is a commitment and there is a method to make sure that the care team can stay connected and that the patient is in the best possible position to prevent avoidable readmissions. And again, the start of that is to make sure that you have a communication method with that patient. Probably the second most common answer to that question has been the use of tracking services and technologies. So virtual care platforms and extensions to those that allow things like video calls, that may also allow patients to submit certain vital readings, their temperature, their pulse ox, things of that nature, that but from their home. So they don't have to come in for those sorts of check-ins that these delivery organizations are using technology and services in order to keep up with kind of that near real-time approach to making sure the patient is on track.
So what are some of the potential pitfalls to a bundle care model?
Certainly, we all understand that a primary incentive around a bundle care model is to keep patients out of the urgent care, out of the ED, and frankly, out of any sort of procedures, unless that procedure is going to improve a condition. When I think about the days of predominant fee for service, I think about hospitals, buying things like new MRIs and CT, very expensive imaging equipment. And when those purchases were made, it was all about, well, how many scans can you do a day? Because there's revenue tied to every one of those scans. But with this model, it's a completely opposite mindset. So in a value-based care approach, it's all about only doing a scan when absolutely necessary, not spending that money unless it really does make sense and is going to affect positively. Not that they were ordered previously in a fee-for-service model unnecessarily, but there's such a greater scrutiny and just a different mindset when it comes to what's needed for the patient and all the costs surrounding those needs in order to keep that patient healthy, whether it's therapeutic, diagnostic, preventative. And then also what is coming out right now as more and more organizations are moving towards a value-based care model are things that we maybe are not really focused on, but it's truly having an effect and not a great one. So I'm hearing about physicians giving out their personal cell phone numbers to patients at such an incredible level. We all know, of course, HHS gave everybody the flexibility and the leeway to do so in the crisis, and luckily it's only temporary because there are so many other reasons why that's not a great idea. But as we're settling into this new normal, highly overused term, I know, but best way to describe it as it is. And again, the incentive around making sure your patient stays well is staying on their care plan and is not going into the emergency room when they don't need to, or seeking higher acuity care when they're part of your risk contract. So a way to mitigate that seems to be this sort of desperate move, although with the best intentions, where physicians and clinicians are giving out their personal cell phone number. It's well understood the HIPAA issues, especially when we go back to our expected times as far as compliance there. But what it is also doing is it's creating a burnout element to these specialists, to this population of our healthcare market, which are the providers. Once you give out your personal cell phone to a patient, it's impossible to take it back without changing your phone number multiple times. And so for all the best reasons, this is happening. But what is also important to be in this conversation is why are we not running towards technology to not have this be the only way to provide the best level of service to your patients? There are platforms, virtual care platforms, that absolutely give that feeling of direct access to clinicians, bypassing after hours services, that are the in between the patient and in between, so they're kind of running the phone calls between the patient and between the on-call physician. So cutting all of that out, using technology that gives a patient the feeling that they can text their doctor like it's their personal number, but it actually isn't. That they're able to text into an office phone number and it's actually getting routed to the right physician at the right time, whoever's on call, whoever that patient needs to be directly connecting with. And it gives that physician some distance. It gives that physician the ability to triage, to filter, to route, but then also to connect. And all still being able to have some barriers as far as their own personal phone number and not having to feel. What I hear doctors telling me who have been giving out their personal numbers is they're always on. There is no off button anymore in their life. And it's not only them, it's their families. And this is sort of the next crisis, I think, because we did give everybody the ability to work outside of what was a HIPAA. It was a HIPAA violation previously to exchange PHI on any personal device, but we've created sort of another problem now, and that's where there's this plus so many other elements that are a part of the new virtual care approach that we need to be thinking bigger and more strategic around. That the EHR portal and emailing somebody and hoping that they get back to you is not going to give somebody any sort of satisfaction when at 11 p.m., their painkillers have worn off and they're not sure if, they have a more critical issue or not. And, what happens today is if they can't get a hold of somebody immediately, then, patients tend to go into the emergency room, and we obviously want to keep them out of there.
It's a comprehensive workflow that allows you to treat your patients where they live. And where do patients live? They live on text, they live on social media, and everything that is needed to deliver care needs to come to them exactly where they live, instead of expecting patients to come to your physical practice office.
Exactly.
All right. Well, that's a wrap for today.
Well, before we go, as always, we want to thank everyone for listening. We really appreciate any comments or questions that you might have. So if you would like to submit any of those, please go ahead and please visit us at our website, which is www.rhinogram.com, and go ahead and submit an inquiry form. You can also text us at 423-451-8534. And for everyone out there, please stay safe, stay healthy, and we will talk to you next month.
Thank you for joining us on Talkin Telehealth, recorded at Rhinogram headquarters in beautiful Chattanooga, Tennessee. You can learn more about Talkin Telehealth on the show's program page at HealthcareNOWradio.com or Rhinogram.com. Find us on iTunes under Healthcare Now Radio, or tune in Monday through Friday and listen through your smart speaker by asking, "Play Healthcare Now Radio." And be sure to connect with Rhinogram on Twitter, Facebook, and LinkedIn. We'd love to hear from you. And remember, if it's in the world of telehealth, we're talking about it.